Okay, so Assalamu alaikum. Well, in this video tutorial, we are going to talk about Norma Basalis, that is the inferior view of the skull, and it looks something like this. So we will be dividing into three main regions to study it easily. First is the anterior part, the middle part in blue, and then the posterior part. In this video, we'll only talk about the anterior part of Norma Basalis, and we'll see the various structures which are forming it. So these are the bones which will be contributing to the formation of the anterior part of Norma Basalis. First of all, there is an alveolar arch, that is the alveolar sockets for the upper teeth, right? It is forming the anterior most part of the Norma Basalis का जो anterior component है. Then we have four bones here, two anterior, two posterior bones. The anterior bones are basically the palatine processes of the maxilla. These two are the maxilla bone. उनके जो palatine processes होते हैं वो हमें नजर आते हैं, which are being connected by the intermaxillary suture. Then we posteriorly we have two other bones. This is forming the anterior two third of the anterior part of Norma Basalis, and this is forming the posterior one third of the anterior part of Norma Basalis, and these are the horizontal pairs of palatine bones. Okay, and these are connected with the interpalatine suture. Okay, so in the middle we have a cruciform suture that is being formed by the intermaxillary suture, interpalatine suture, and the maxillopalatine suture. So this is the bone. These are the bones which are contributing to it. Then we say that the superior aspect जो हमारा होता है ये वाला anterior part of Norma Basalis, it is dome shaped, और हम feel भी कर सकते हैं हमारा जो तालू होता है, it is quite you can say concave or dome shaped in order to increase the area of the oral cavity for eating purposes maybe. Then we have another fossa in front in the median plane, just you can say anterior to this interpalatine suture, or I should say intermaxillary suture. के आगे एक हमारे पास fossa होता है, that is called the incisive fossa because it is present behind the incisors. So this is the incisive fossa, and this is important because it is lodging two foramina called as the left and right incisive foramina. यहाँ पे नज़र भी आ रहे होंगे रेड कलर में, ठीक है. And these foramina are basically moving inside the groove called as incisive groove or the incisive foramen. इसके आगे foramina होते हैं through which it is communicating with the greater palatine foramen as well. So all these things are connected, interconnected. So हमें मिला incisive fossa, then the incisive incisive foramina. Okay. So okay, with this note we're done with this, and then we have some other foramina as well, the greater palatine foramen and the lesser palatine foramina. The greater palatine foramina are present just behind the plateau maxillary suture, and this is we are saying that this is connected with the incisive foramen as well through a groove. Okay, then the lesser palatine foramina are present behind the greater palatine foramen, and these are 2 or 3 in number, and they are perforating the pyramidal process of palatine bone. This whole is a palatine bone, by the way, और दोनों साइड present होते हैं, greater भी और lesser भी. Okay, so yeah, with this note we're done with all the foramina, and then what else is remaining. अच्छा, कहा जाता है जो posterior border होता है palatine bone का, it is quite free and it is lodging a spine called as the posterior nasal spine. If you can recall, हमारे एक anterior nasal spine भी थी जो कि maxilla bone बना रहे थे, and the posterior nasal spine is being formed by the palatine bone in the Norma Basalis. So in the middle we have a spine, and इसी spine से निकलते हैं lateral aspect पे दो crust called as the palatine crust. Okay, so they're moving towards the greater and lesser palatine foramina. So this was all about the anterior aspect or the anterior part of the Norma Basalis. In our next video we'll talk about the middle part of Norma Basalis. So till then, Allah Hafiz, take care.